The first part of my treatment, which is the Santa Fe protocol to reverse the vision loss of macular degeneration, involves placing ear studs. These studs are little tiny gold-plated barbed units that stay on for several days. There are several places on the ear which I'm going to stimulate. This sounds a little unusual, but it is actually backed by lots of hard science. Paul Nogier was a French neurologist, and about 50 years ago, he discovered that the external ear sends lots of nerves to the brain. He's identified the points, and it has been validated more recently by David Alamy, who is professor of ear acupuncture at University of Paris Medical School. What Dr. Alamy did was put a needle in the part of the ear that Dr. Nogier had said represents the thumb. He then did a functional MRI, a real-time MRI, and lo and behold, the part of the brain that represents the thumb lit up. That is a very good direct evidence. Now, what I'm doing, Ed has been treated several times this week, so he has most of his studs in place. I'm going to put another 2 in, and what we're doing is directly stimulating the optic nerve and also stimulating the body to produce more cortisone. If it's producing its own cortisone, that gives the body all the good features and none of the bad features that happen when you administer cortisone by pill or by injection. But I've checked Ed over, and those are the only 2 studs he needs right now. Now, Ed, sometimes these studs are uncomfortable. How much do they hurt?
Very little. It's uncomfortable to try to sleep on them. I'll tell you.
Well, they do sting, but hopefully they aren't too horrible. The second part of the treatment involves recognition that the Chinese were good observers. They observed that there are several points on the body that affect the eye. I'm going to use a French energetics approach, which is going to move electricity along this series of needles. Now the far end, the uppermost portion, the takeoff to the head, happens to be right on top of the parasympathetic plexus. The parasympathetic plexus is one that will send parasympathetic signals, which are the opposite of sympathetic signals. Sympathetic is mediated by adrenaline. Your body heart rate accelerates, blood pressure rises, and blood flows to the arms or legs so you can run away or fight. With parasympathetic, it causes blood pressure to go down, heart rate to slow, and blood is diverted to the digestive system so you can rest or relax, rest or recuperate. And it's very interesting that the eye has a terrific amount of parasympathetic stimulus. All physicians know, for instance, that if you have a patient with a racing heart rate, all you need to do is press the eyeball and you can slow the heart rate. Next, I'm going to go and put needles around the eye. They're not in the eye, it's around the eye. The needles that we're using around the eye are very small. They're 0.12 millimeters in diameter. That's much smaller than a human hair. They are flexible, and one of the nice things about them is that they actually cannot even penetrate skin unless there's an introducing tube. I expect that what this is doing is curving around the eye and is taking the least resistance area, which is the fat in the periorbital area. They're so small that they certainly will not penetrate the eyeball. I stay far away from the eyeball anyway. If we got anywhere near to the sclera, the tough membrane on the outside, we could recognize a texture change. And even if the needle somehow managed to get in, the hole would be so small that it would not cause damage. These needles are 1.25 inches long, and we're going to use a Canadian neuroanatomic approach to stimulate the retina itself. By putting these needles in, we're really basically bracketing the entire retina. This place in the outer inferior portion of the eye happens to be the site where anesthesiologists inject anesthesia regularly, thousands of times a day, every time somebody has a cataract operation or a other eye type of work. That's where anesthesia is placed. This next site, where I'm going to introduce a needle, is one that I added most recently. I had a lady who was getting a lot of improvement in vision, except in the outer upper portion of her field of view. And this was the one site that I hadn't put a needle before. So I put a needle here, started stimulating it, and sure enough, the upper outer field of vision cleared. This one is the one that's closest to the optic nerve. It's the reason I'm using a shorter needle here. The other needles were 30 millimeters, and these are only 15 millimeters. In some people who are very thin, the optic nerve is only 20 millimeters away, and we wanted to avoid hitting the optic nerve. Next step is to put a visor to hold or act as a support for the wires that I'm going to put on here. We keep modifying what's being done here, and I'm using very lightweight wires and very lightweight clips. That's one side. So all clips are attached. Now I'm going to start the electric signal. The electric stimulators create a small signal, and I try to adjust it so that people can just feel some tapping, but it's not painful. And this is the left lower eyelid.
Yes.
This is left upper eyelid.
Yes.
Are any of these signals too strong?
The left upper is a little bit strong.
Left upper too strong. Better?
Yes, that's fine.
We can control the intensity, and this is not supposed to be a painful operation. Everything reasonably comfortable, Ed?
Yes.
Okay. We'll let you percolate it here for another 20 minutes, and see you tomorrow.
Okay, sir.